Thanks, Premier. Certainly we're seeing some stabilisation in numbers. We've got 400 to 500 cases each day. That has been more or less the average for the last week. That's not good enough, but it is a positive that we've averted an exponential increase through the last couple of weeks. If we hadn't stabilised these numbers, we would have seen thousands of cases per day, and there are estimates we've averted 20,000 or more cases by virtue of the stage 3 restrictions. But as I say, that hasn't been enough. That's been able to stabilise the numbers, but we cannot have 500 cases every single day and the associated morbidity, hospitalisation, intensive care requirements and deaths that are associated with that number every day. Stage 4 restrictions will make a difference, but we won't see them for another week or more. But we can drive numbers down, and we will drive numbers down. The ongoing challenges will be in the outbreak settings. We know that aged care is particularly vulnerable. We've got over 1,600 active cases in aged care at the moment. Our healthcare settings are another area where we absolutely have to make sure that we can protect everyone in those settings. The other outbreak settings are our high-risk industries, and I spoke yesterday about disability settings. Even though the numbers there are significantly less than in aged care, it needs the same coordinated and rapid response. There is a rapid response outbreak unit that coordinates in the same way the emergency management operations, the Commonwealth and state responsibility to manage cases in those settings. But across all of those outbreak settings, we really need both a prevention, a rapid response, and then as community cases are driven down and there's less introduction of virus into those settings, we really need to make sure that they are protected from any further cases. If they become COVID-free, if those outbreaks are ended, then we absolutely have to make sure that they remain COVID-free. That will require all of the things that we're trying to get in place now, but some real vigilance and with a particular focus on staff and the very first symptoms that they might develop, and to make sure that they're isolating at the very first instance. But it's all of those elements, including the personal protective equipment, the training and the rapid response that needs to be in place.
A shortage of PPE in their workplaces. Is that good enough, and what can be done to help them?
I might have the Premier speak to that. My understanding is there is no statewide shortage of PPE. There is no bottleneck in terms of distribution to any healthcare facility and to healthcare workers as is required. So there's certainly no lack of PPE in order to protect those healthcare workers. But I'll get the Premier to speak to it. The effective reproduction numbers likely to be under 1, certainly in the 0.9 kind of range. But these are modelled estimates, and they're a best guess. They work on assumptions that go into the model, but they're also updated on a twice weekly basis with the numbers that we're seeing each day. So it's both an assumption around the movements that we're seeing across Melbourne, across Victoria, but also following the numbers each day to try and see if that effective reproduction number estimate is validated by the numbers we're getting every day. So I think we're headed in the right direction. That 0.9 really needs to be at 0.5. I think stage 4 restrictions will head us in that direction. How far we can get there is a matter for all of us as community members and our behaviours, because it does relate not just to the work settings that are obviously constrained in stage 4, but all of our individual interactions with everyone around us, including our family members, including our workmates. So it's one thing to be a permitted worker, but it's another thing about doing the right thing when you're at that workplace. And so that effective reproduction number will also be altered by how many people stay home when they're unwell, how long it is from the very first symptoms that you get until you isolate. If that is 3 days for some people now, we're not going to get to an effective R naught of 0.5. We need people to isolate from the moment they get those first symptoms, the scratchy throat, the runny nose, the beginnings of a cough, the very beginnings of a fever. That's also part of the equation in terms of getting transmission down.
We're looking at an aged care centre today that doesn't have any confirmed cases of COVID, but has invited its staff to actually move in and live on site to limit their interactions in the community and hopefully limit the spread if a case does occur. Is that the kind of innovation that you're looking at businesses implementing to try and help combat this?
Yeah, I think we need to look at every innovation, absolutely. There are lessons out of Europe, out of North America, but especially out of Europe. And some of those were about the fact that you don't move people into acute care settings. I know there's been a lot of discussion around, some imperative to move all positive cases out. But it's clear that there are innovations that relate to how you surge the workforce in an aged care facility to manage positive cases and to manage the close contacts, to manage all of the other residents in those settings. And having staff on site is absolutely an innovation to the extent that it limits their interaction with other community members. We know that a number of aged care workers are picking up that virus in the community, and so the extent to which that interaction can be limited is absolutely a positive thing.
How and when do you start measuring the effectiveness of mandatory masks? When do you expect to see that in the figures?
Look, it's a bit tricky to know exactly how the effect of mandatory masks will be seen. There have been other interventions. The curfews come in through that period. Other changes in our mobility has occurred during that period. But there will be academics who will no doubt try and tease out those other factors to see the effect. There are some estimates that it can reduce the effective reproduction number by about 15%. If that's happened in Victoria, that would be absolutely a good thing. That's many more thousands of cases over the forward period that have been averted. One of my concerns, it's clear that people have taken up masks really, really well. One of my concerns is it happening in the settings, with the people, and at the times that it's most required? So again, you can see lots of people wearing masks in lots of settings, but are people in the workplace, in high-risk transmission areas, at all times wearing those masks? Or are they taking masks off at tea time, at a break period, and then sitting very close to workmates? So the numbers will let us make some estimates about how well masks have been used, but it is a critical thing that it's a universal, all-time, all settings recommendation.
There have been some suggestions out of the EU that it will take at least 4 weeks to see numbers drop. Is that a more realistic time frame than the fortnight?
No, I think we'll see numbers drop before then. I think, the very dramatic reductions that you can already see in traffic, foot traffic, road traffic in Melbourne in particular, is an indication that there's been a significant shift already. Of course there's going to be a shift. There are workplaces that are closing, there are many others that have scaled back, and there are very clear directives about working from home if you can work from home. All of those things will make a difference, and I think even though there were policy settings that everyone who could work from home should work from home, there was probably more traffic on the roads that indicated that not everyone was doing that when they absolutely could. I think the great majority were, but we can go further, and I think that's in place now, and I think we'll see the effect of that in the next 1 to 2 weeks.
Is there any evidence to suggest that Melbourne is battling a mutated or more infectious strain of the virus?
No, I don't think there's any evidence that we've got a tougher virus in terms of its transmissibility or its severity. We do have the challenge that the world has of second waves, the behavioural fatigue, the ability to penetrate with the message, the ability for people to sustain those behaviours over such a difficult and long period of time. That's why Israel's second wave is 4 times bigger than its first. That's why Spain's already looking at a second wave that's almost as substantial as its first. That's why Iran never really moved through its second wave. They couldn't get those changes to come into place. We're working so hard to make sure that we can shift those behaviours and make the structural differences that limit the interactions that people have so that we can get through it.
Those mystery cases went up 130 today. While the overall number seems to be going down, that seems to be sticking around. How worried are you by that, and why is that still happening now?
So they're the mystery cases that have been resolved today. They're the ones that have been finalised for each of those cases. But tracking the proportion of community cases or mystery cases as a percentage of the total over the last month has had some positive signs. We've seen a proportion at about 16-17% early in July. It increased up to 26-27%, and then it's come back down, and it's probably sitting, if you look at each day, sitting at around 17 or 18% again now. So the numbers that we get each day are the numbers that get finalised in the data. They're not the day's figures.
Healthcare workers, it seemed like there was a bit of a jump there today. Is that driven by any particular settings or?
Oh, we do know that healthcare workers are affected across all settings, but there is a significant proportion that are support ancillary workers in healthcare settings. Nurses make up a bigger proportion than doctors. And aged care workers make up another significant proportion. So it is a spread. It's all concerning, but the response is, not dissimilar across the board. We have to make sure that people get the PPE that they need, that they're using it appropriately, and that the first signs and symptoms of coronavirus means that those individuals are isolating, that their close contacts are quarantining, they're getting tested, and they're getting those results back quickly so that their close contacts can be followed up appropriately as well.
On contact tracing, I know you say that people get contact within 24 hours, but it seems like that's not actually tracing the contacts. We get reports that it's a week up to a longer. How kind of concerning is that, and does that kind of, in the same way that people were breaching restrictions, if people aren't getting their contacts traced, does that kind of just null and void any impact that the restrictions might be having anyway?
No, the restrictions will have a significant impact regardless, but it's not a substitute for contact tracing. They need to work in concert. And we know that when we've got over 7,000 active cases, that the contact tracing surge is really challenging. But we also know that there are countries in the world, jurisdictions of similar size or much larger than Victoria, that stopped contact tracing at 50 cases a week. We are at 2,500 cases a week, where we're still doing contact tracing. But the system gets stretched in terms of the time to get swabs to labs, for labs to process them, for all of that data to come into our database, and for all of our interviewers to do the interviews and the contact trace details to go in and then automate that message to all of those close contacts. That pushes out the total time more than I would like, but it's a measure of the scale of cases that we're getting every day and that we need to follow up. When we start to drive down cases, that will be more and more efficient and people will be contacted even earlier. I've heard that there are moves for individuals to be aware of their status as soon as they hear their own result and to follow up with their close contacts. That is not a bad thing. I would also encourage those individuals, if they're confident and comfortable in doing so, to let their close contacts know that they need to quarantine, so stay away from others until they can get the formal notification and be followed up.
Our limit is on weekly or daily numbers in terms of being able to keep the contact tracing going?
I don't think we're close to limits. We've got spare capacity in the interviews that are done for all of our cases. We could double that and still do it comfortably, but we don't want to get there. Again, the total number of positive cases just increases the opportunity for transmission. It increases the length of time for labs to process swabs. So. It's not a question of meeting our contact tracing capacity. We just need the numbers down for all of the reasons that relate to people's health and well-being.
Any capacity constraints for hospitals receiving patients at the moment, or how is it spread?
Look, I think individual hospitals can struggle sometimes, depending on which workforces are affected. But I've not received reports that there are any critical shortages that are requiring, an emergency intervention.